is Dr. Navneet Toshniwal, who's going to speak to us about Phaco in different varieties of cataracts. Light kam ho sakti hai yahan pe? Nahin, no?
Respected chairperson and colleagues, please start the video, sir. Phaco in a variety of cataract. In 7 minutes, we will try to see some important condition, that is a soft cataract. Hydrodelineation is very important to see the size of nucleus. That is very important. If it is very small, size is less than capsular axis, not very hard, even a visco expression is very important to remove these cataracts. Now another condition in a soft cataract, when you do the hydrodelineation, multiple rings delamination can occur, and you try to see that whether this size can come out or not. And this is very important. And then I try to same manner that whether I can able to lift this nucleus or not, but no, definitely not. And then very important, again we will go back with the stop and chop technique, try to remove some of the epinucleus if it is not give the good view, and central trench, that is the most important, not really very deep, adequate depth. And this is this topic is the instrumentation which assists you in your surgery. So this is the Toshniwal pre-chopper. It is a typical design instrument. Give the equal pressure on a 2 halves of the nucleus. Why it is important? Because soft cataract, if you think of the divide also with the small instrument, you can see that the instrument can pass through the substance. So it is not very easy to divide these nucleus, and then you can do many ways. You can do flip chip, you can go, try to hold, try to suck it out, do with the vacuum, many things. But if you want to go systematically, you should have the instruments with you, that is the pre-chopper. So that's why that was a demonstration. Many times hold is very difficult, so after this we can take the decision of half piece has been delineated and visco express it out and remove it out. So this is a very simple way to see this soft cataract, because these are the challenging situation. Now see the other eye. What is the significance of hold? It should be very, very slow, not fast. We have to go from one plane to other plane. So here, although it is a slow, minimum parameters, very important. In Jordan, I was doing live surgery. I could not hold the things. Alcon guy was there. This is story of 2008. Suddenly he increased the parameter because there was no hold. Then we have to cut down the hold. Parameters. These are very important point. So knowledge of our knowledge is also important to tackle this simple situation. Then visco expression, why methyl cellulose is very important. In European community, they don't get the methyl cellulose. They are having the Hilon, GV like this. But methyl cellulose is such an important, when they come for training at our center, we can show them how this simple product is so useful. And you can see here how the visco expression, because this is a bulky mass. You do with the coaxial, you do with the bimanual, still it is a very simple is the visco expression. In mature cataract, I am just showing the very simple. This is the Toshniwal microcapsular axis forceps, designed by me, by Sunaina Surgical and Seagull Optics also. So make a small nick. This is very important. A complete axis is important. Then you can do the debulking of the tissue. Many times we see in the presentation, they just take one nick and they try to aspirate. Out of 50 cases, 5 will run away. So complete capsular axis is very important. And then again the use of the Hilon like things, or whatever dispersive you are using, how to put, where to put, how much quantity we have to put. This is important. Another instrument is the micro Caesar. That is also designed. It is by Seagull Optics, and we are completing after debulking. It is a very different, unique design according to the anatomy. So that will assist. I generally don't do hydrodelineation, dissection, no need, because you cannot go in the correct path, correct plane. So directly start with the stop and chop technique. Here you cannot predict what depth, but again a pre-chopper is very important, and once it is equal division, your job is easy. And lift it out, again lift it out and use at a plane of a capsule, remove it at a plane of a capsule. So instrumentation definitely makes the difference, although these cases routinely we are doing. Now hard cataract. Again a stop and chop technique. Definitely there is no space between capsule and the lens, so I don't do more hydro. In these cases also, just go with the trench. When you are doing trench, indirect hydro is going on. Unintentional hydro is going on. Here the most important step is the division. And that is the reason you have to practice, you have to understand what is this. Now see, we are trying to divide, it's a leathery structure, not very easy, but because of the pre-chopper, you can take the chance 1 time, 2 times, 3 times, equal pressure on zonules all the times. So that's not damaging the zonule, that is very important. Slowly, this is another very important, many times we have to do in situ, but I try to bring at the level of capsule, I try to bring at the level of iris plane, and then chop we can do. Another very important point I want to highlight, many times in a hard cataract we are using fancy choppers. I think it is not really needed. It's a very simple chopper we are using, modified Nagara chopper. This is also with the Epsilon, that is a Toshniwal chopper, and hold is very important. If you hold nicely, then you can chop. Partial chop is a very typical idea, typical point. You can do the partial chop and we can do.
So your time is up.
Yeah. So these are the different ways we can do the nucleus emulsification in different variety of cataract. Thank you for your patience hearing.
Routine Akahoshi chopper. What is
I have done the Nagara chopper is a straight shaft.
Okay.
I have make is a corneal, parallel to cornea.
Curve.
And the vertical distance I have cut it little bit less, so that it is a modified.
Is it
That's
patented and it is a financial interest?
patented? No,
No
but
patent.
they are Toshniwal chopper as in Epsilon stall. Yeah. Thank you.
Ask another question.
Yes.
When you're looking at a rock hard cataract or a fairly hard cataract, grade 3 brown and above, do you not find any meritosity? You mentioned if you get a good hold, you can chop. Do you not think a sharp tip chopper makes this mechanical split easier?
Definitely. It will make the things definitely, but there is at the same time there may be risk with these sharp choppers. And that is the reason clinically what we say, if your hold is strong, and which is very important,
Correct.
hold if is excellent, you just touch, it will chop. And then I mention it is a partial chops. I am not interested to do the complete chop. So partial chop will make the sense that you can eat the piece, that base, again you can catch the other material.
A multi-layer chip.
That is the way.
Thank you. Very well
Thank you very
presented.
much.
Thank you so
very
much.
much.
One more point was during your visco expression of the soft nucleus, we can go with the bimanual, and with the aspiration go to the main port, just tip it a bit down on the main wound, and the epinucleus also comes out.
Exactly.
Yes.
Thank you very much.